I'm Dr. Sudhir Bhandari, Senior Professor of Medicine and Diabetology at SMS Medical College, Jaipur. It's been a pleasure to be here and delighted to have such a novel initiative of women health started by Biocon. Truly speaking, I think the health of women in India needs a special care, special attention, and special management because of unique condition of women in our country. I'm sure this program is going to enhance the quality of life which women deserve.
So what do you think? Do you think there are rising incidences of heart disease in women in India?
Yes, you're very correct. There's a very high incidence of cardiac problem in women. After menopause, the women have an increased incidence of thromboembolic phenomena. Secondly, Indian women are more sedentary. They are more of household ladies. Their physical activities are less. The BMIs of Indian women is average much higher than the Western world. Their waist hip ratio is also higher, and all the cardiac risk factors of Indian women are much higher than the Western women. And in the light of all these facts, the Indian women come across a lot of cardiac problems, and it requires a lot of attention. Especially, we need to be very sensitive, very careful, and we must have in mind that women are few times more prone to have cardiac problems than men, though they are less complaining.
So do you think that we as Indian society have a mindset in terms of gender bias that women comes at last priority in our house? Do you
To
think
be honest, it used to be. We always had a male dominated society, and Indian society is very unique where women treated husband as God, husband to be respected, and the women always had a pride in taking extra care of man and neglecting themselves. But with the changing scenario, with more women working, with more education being there, I think this gender bias is changing towards neutrality, and I'm sure man is also becoming very sensitive towards women's health and care. So I'm sure to begin with there was a gender bias, but with the more education, more change in aptitude, this gender bias is changing now to neutrality.
so? Do you think this Queen of Heart initiative will bring some change?
Yes, yes. I think it's a great program. In fact, it will prime up not only man but especially doctors. It will prime up doctors so much, society so much, and priming up of doctor is so important that any woman who comes in that particular vulnerable age, I think will be very able to impress upon, and more so in presence of their husbands, that we need.
Continue, continue.
Should I continue? Okay. So this program is going to be very interesting program because it will sensitize man, it will sensitize husband, and it will also sensitize doctors. Any woman in particular vulnerable age comes to us with some other specific or non-specific symptoms with the high risk factors. I think it will drive us to investigate them thoroughly, make them very careful about it, take all preventive and curative medications about which women are little negligent. So I'm sure this program is going to sensitize cross section of society, and I'm sure with this program we should be able to achieve the goal of preventing and protecting women from the cardiac problem.